Welcome back. As more cases of coronavirus are being detected in India, a high-level committee of Health Ministry has been formed to review the preparedness. Prime Minister Modi has asserted that there is no need to panic and all the states and centre are working together to contain the spread. The Cabinet Secretary held a review meeting with the secretaries of concerned ministries. Chief secretaries and health secretaries of the states have been asked to review and assess the actions taken for containment of Covid-19. In a move to prevent shortage of essential medicines, the centre has restricted the exports of a host of medicines. Air India has cancelled several flights going to Seoul, Tokyo and Bangkok, amongst others. DGCA has asked all the airlines to disinfect all the aircrafts arriving from South Korea, Japan and Italy. So is India ready for coronavirus or not? Is India prepared for Covid-19? One hospital per 47,000 people. There you go. You've got the answer whether we're prepared or not. One doctor per 10,000 people. 6 beds per 10,000 people are required. 16 nurses per 10,000 people are required. Director General of Health Services information coming in right there. India Today's consulting editor Rajdeep Sardesai spoke to Union Health Minister Dr. Harsh Vardhan, who asserted that there was no need to panic over coronavirus scare.
Joining us now is a very special guest, the Health Minister of the country, Dr. Harsh Vardhan, on the big coronavirus scare. Appreciate your joining us, Dr. Harsh Vardhan. 2 positive cases detected in the last 48 hours, one in Telangana, one in Delhi. It spread an element of panic. What would you say as the Health Minister? Is this panic and scare over coronavirus justified or not?
See, a concern is okay, but panic is, I think, not justified, neither necessary. You have to appreciate that we have been working on the prevention of the entry of coronavirus in the country for almost, I would say, 45 days now. We started the whole thing on 17th of January, 2 weeks before the World Health Organization declared it as an emergency of international concern. And you have seen that in a country of 1.35 billion people, we have till now only these 5 cases which are positive, and another Italian who has also traveled to India, who has also come out as positive. I think there is no cause for any panic at all, and I would urge upon people like you and your television channels also to help us in appealing to the people, because they have to just take some simple precautions about hygiene, cleaning of hands, maintaining etiquettes while coughing, sneezing, and then reporting to the system if they have some fever or maybe some sore throat, some respiratory difficulties, and of course, yes.
No, while you say there is no need for panic, while you say that in a large country like India, we've just had a couple of cases, how prepared are we is the question, because here you've got a situation which could spread. I'm not saying it will, it could spread. How prepared are we? We have only 5 laboratories for testing, I'm told, when according to health experts, the minimum is 29. There are questions being raised over the manner in which screening is taking place at the airports. How prepared are we?
I think we are thoroughly prepared, and I think you are probably, you see, information is not correct. Number one, right now, we are already doing this testing in 15 laboratories in the country. That's number one. By tomorrow, another 19 laboratories are going to be starting their functioning. That's number 2. And even at this stage, we are in a position that by tomorrow we will be creating one laboratory with scientists and all the equipment and all the reagents in Iran itself, to make sure that when we bring back the people from Iran, all our Indians, we first test them there, because that is the request that we had made to the Iranian officials also, but they said they may not be able to help us on that. So we are creating a laboratory there itself. Already one scientist has gone there, 3 scientists, and everything is going tomorrow.
There are many precautions that we as individuals can and must take to protect ourselves and to prevent the spread of the coronavirus. But what all measures has the government taken so far, especially at the airports? India Today's team of reporters spread out to report the ground realities and show us how the different ground realities are different at different airports across the country. Here's a look.
As India confirms 3 positive cases from coronavirus, airports across India are on high alert. The ministries and thermal scanners have been stationed at the pre-immigration area for the passengers. Passengers feel there is a need to increase awareness about the deadly coronavirus.
I guess थोड़ी सी और preparation की ज़रूरत है. Because I see here कि लोगों को ने पहना ही नहीं हुआ है, and but they need to understand this, that it is spreading widely.
It'll hardly take a very little time for the virus to spread, so I think we should be a bit more concerned about our own safety.
21 airports have been fitted with screening machines. Stringent screening is taking place not just at airports but also at various seaports. The government is also saying that the Prime Minister himself is closely monitoring the situation and also looking at the number of patients in the country. Very recently, there were 3 people, one in the national capital, the other in Jaipur and the third one in Hyderabad, who were tested positive.
Flyers in Chennai could be seen taking preventive steps. Many were spotted wearing masks.
As I'm a doctor, I'm aware of like what kind of viruses, like how we can get infected from passengers, co-passengers, and by touching places like public places. And I used to sanitize myself throughout the journey, and by wearing mask, I want to protect myself.
Yes, minor precautions, nothing excessive. I'm washing my hands regularly, and just when I'm in close proximity with other people, I'm wearing the mask.
As many countries are trying to combat the coronavirus, even at the Chennai International Airport, all measures are put in place. The entire staff has been briefed by the airport authorities on how to tackle the system. Now, passengers, when they take their flights, in the flight, are given out pamphlets which they have to fill and return to the crew. They have to be upfront if they have a fever, if they have a respiratory disorder. They are expected to tell the crew that. As soon as they land, they all undergo thermal scanning, and anyone with a fever or a cold is kept aside. There are ambulances such as these outside the Chennai International Airport.
At the Kolkata airport, passengers coming from various Southeast Asian countries are being screened through thermal scanners.
For precaution, we are keeping this mask with us, and as it's an international airport, so anything can happen.
Passengers who are coming in from Southeast Asian countries, specifically from Thailand, Malaysia, Indonesia, all these countries, those flights are being screened heavily, and all those passengers will have to submit a declaration, a health form, which is being given on board the flight. When they alight the flight, they will have to fill that up, and there is a specific desk where health officials are there. So first, the passengers will have to submit that form and also go through a thermal scanner screening.
Mumbai International Airport has also increased screening.
Mumbai International Airport is maintaining high vigil and screening passengers arriving from around 14 countries. These countries are China, South Korea, Japan, Italy, Iran, Hong Kong, Macau, Taiwan, Singapore, Thailand, Malaysia, Vietnam, Indonesia and Nepal.
As the worldwide death toll due to coronavirus crosses 3,000, India is taking no chances. Screening is being tightened at airports across the country. Bureau Report, India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.